Hi, I'm Renee Burrell. I'm a nurse practitioner at Advent Health.
I'm Andrea Anderson, and I'm also a nurse practitioner with Advent Health.
So a nurse practitioner is basically an RN who has been practicing as a registered nurse. And what we do is we go back to school to learn more of the medical model and disease management. And you also have to take another board and pass that to become a nurse practitioner in good standing in Texas. So the training is a little different. We do a lot of what physicians do. However, and again, we can specialize much like the physicians do. However, their training is a little bit more extensive and more in the medical model. We get a lot of our training at the very beginning through nursing, and we do the lifespan. So we do death to dying, and we do all fields of basically medicine, pediatrics, everything. We do pediatrics, adult, pregnancy, and then we decide once we graduate what kind of field we'd like to practice in. And we usually have a physician that we collaborate with any of our questions.
Some things that nurse practitioners may do that physicians do not do, or vice versa. Physicians may prescribe controlled substances where some nurse practitioners we are a little bit more regulated by our board on what we can and cannot prescribe in a quantity of stuff.
But basically the nurse practitioner does everything a physician does. So we can assess you, we can diagnose, we can order imaging, we can prescribe medicines that we think fit for either your acute illness or your chronic illness. We manage diabetes, high blood pressure. We also can maybe with your preventative, we also can find some things that maybe you need more testing on. So we can refer you to different kinds of specialists that can either be an MD or, again, another nurse practitioner. As a registered nurse and becoming an NP, we actually can run our own practice and run our own business as a family practice or whatever we decide to do. Again, we're regulated by our board that we do have to have a physician that we have to collaborate with, but as a nurse practitioner, we can open our own practice. So you can find some facilities that are run by nurse practitioners, that are managed by nurse practitioners, and a lot of times the physicians will be in a different practice and will run their secondary practice. So we'll be only there, but we can also talk to our physicians if we need to. But yes, so a lot of the nurse practitioners in the state of Texas can run their own business and have their own practice.
Definitely a personal choice. I would say pick whom you feel more comfortable with, who you can be open and honest and just be comfortable with, because like Renee was saying, we both can prescribe medications, we both can order imaging. It's a pretty even scale of who you want to see, just who you feel more comfortable with. I think there's just a higher demand for it now with the growing population. Physicians just are not able to see the patient load, and so us as nurse practitioners can act as a substitute and help out with seeing those clients so that those patients can get seen for those visits that they may have to have waited for the physician to see.
And really how the nurse practitioner role became what it did was that a lot of the physicians years ago, I think it was in the 80s, were actually going to school, but they were specializing in cardiology or oncology or whatever. So they were lacking people or actually providers for primary care. So that's really where the nurse practitioner role came, because we do a lot of that. We're at the bedside a lot. We've seen death to dying, depending on what we do as nurses. And we had the medical training. So plus we have the holistic training of being an RN. So they thought that the nurse practitioners would be a great transition to help the nation with a shortage of primary care doctors. So that's really how the role came about as becoming a nurse practitioner. So when you're looking for a provider, it's really, we both do the same. Again, physicians can prescribe certain medicines that we might not can. However, it just really depends on what you're looking for. Are you looking for, but we manage, but you can see a physician and get the same treatment that you would seeing a nurse practitioner. So we basically do the same. It's basically like Andrea said, it's your preference. A lot of people have dealt with nurses more than doctors, especially if you've been in the hospital or you've had family members. And, we are very empathetic and we really care about our patients and we want the best for you. And again, a lot of times we've seen families. So I've been doing this a long, long time. So we've had families, I've seen kiddos that are now grown adults and they bring their kids. So it's basically just seeing a physician, and it's just your preference on what you would like to see. But a lot of people do get the question, or I get the question, Andrea probably does too, about can you prescribe medicine? Can you order this diagnostic? And yeah, we can.
One of the things that I think you may find with a nurse practitioner over a physician is that our schedules are not quite as busy as the physician's schedule. So you may find that we have a little bit more time to really get to know you and ask you questions. And I don't know about Renee, but I'm sure it's the same. One of the things about being a nurse and a nurse practitioner is getting to know your patients. I want to know about your husband or that vacation that you're planning to take, the new 10 pounds that you lost or stopped smoking. We enjoy those and we want to celebrate those and learn about you and really cater your care to fit for you. And so it's nice to have that extra time to spend with our patients.
And, like I said, they've actually done a lot of research on it and found that nurse practitioners do provide this, care the same as a physician, and that there's a big shortage of primary care doctors all across the nation. So it's really growing, and I think people are now a little bit more comfortable seeing us, and being comfortable seeing us for their chronic management or their acute illness. And we are available a lot and we can see people. So it's also to prevent people going to urgent care when we could just kind of handle it a lot on our own. We do acute and chronic. So the physician assistant and the nurse practitioner basically do the same roles, but their license is under the physician license, where we have a total separate board. Also, when we go in, like I said earlier in our topic, is that we have to be in good standing as a registered nurse in the state of Texas before we can even go to NP school. Physician assistants usually have a bachelor's degree in something. So it can be biology, it can be mathematics. So they have to have that degree and then they can apply for PA school. We can also in Texas run our own business where physician assistants, they can't have their own practice. But again, they work in the same role that we do.
So basically they're doing the same care. So if you have high blood pressure or diabetes or a sore throat, you can see either a nurse practitioner or a physician's assistant and get care. Just basically the title is just a little different.
And our training. And I think, being an RN, we've been in the fields a lot before we even decide to become a nurse practitioner and increase our role and our demands. So that's one of the advantages for us, I think, as nurses, is that we have a little bit of medical background and we've seen some, as Andrea said in the past, some disease processes that are more familiar to us when we go to NP school.
I think that's really important, that nurse practitioners and physicians, they work off of the same kind of guidelines. So the same recommendations that the nurse practitioners will be making for you are the same recommendations that your physician will be recommending for you. Your mammogram, your colonoscopy, we are very aligned in those recommendations. So you're not necessarily missing out on care by choosing a nurse practitioner because our models of care
are the same.